Raul, I really want to thank you. Regret that we're not able to meet this year in person, but want to thank the Society for bestowing the Colonel Thomas Salmon Award on me this year. It really means a lot to me. It really touched me deeply when I learned that I was nominated for the award, and I'm so proud to have been the recipient this year. Really standing on the shoulders of giants in military psychiatry. I've been off active duty now for almost 10 years and really have had a lot of opportunity to reflect on my military career and my career in the VA after leaving, and just am really so grateful for having had the opportunity to serve in the military and meet such wonderful people throughout my entire career. This award is really important, I think, for our society, because it really reflects the legacy of Colonel Thomas Salmon, who was, in the public health service. And then many people may have heard the stories about his evolution from a public health psychiatrist to a military psychiatrist when he was recruited by General Pershing to serve with Surgeon General Gorgas on the Mexican border. And then was brought on to active duty in the Army and served with the Army Expeditionary Forces in France. Where we really codified the principles of, that we hold so dear today, the principles of proximity, immediacy, expectancy, and simplicity, principle of far forward treatment of psychiatric casualties, and really codified his work in working with the Expeditionary Force, learning from the British, and creating the foundation of military psychiatry that we still practice today. When thinking about what this award means, I reflect on my own career, maybe in many ways like Dr. Salmon, that I didn't start out to be an Army psychiatrist. I started my career with going to Uniformed Services University, of course, but never really thought of myself as developing an Army career. I thought of myself as a psychiatrist in the Army. It was only later that I really started to think about myself as an Army psychiatrist. And as I reflect, I think there are a number of people who've really been helped me transform into embracing the military, embracing a military career. I have to say, probably one of the early mentors that I had, a name that may ring familiar to many currently on active duty, is Harry Holloway, when he was chair at USU, and an early mentor when I was a medical student. Not yet deciding to be a psychiatrist, but he was really a role model that piqued my interest in treating psychiatric casualties, in learning our profession, and developing a perspective around military psychiatry. I then went on to train at Letterman Army Medical Center, where there are a couple really influential people there. Some of these names may be ancient history, but some are still members of our society today. Colonel Jim Kent was the chair of the department, Vietnam veteran, Marine Corps lieutenant back in Vietnam, who became a psychiatrist and really brought a very practical and humanistic approach to military psychiatry. Colonel Norm Wong was my training director, a name well familiar to those of us who've been through Walter Reed. Still in San Francisco, I hadn't yet embraced my identity as an Army psychiatrist. It was really after that when I had my first operational assignment with the 1st Armored Division in Germany. I went to introduced myself to the division surgeon. And his introduction was, quote, "I never met a USIS grad or a psychiatrist that was worth a damn." And so that really resonated with me. It highlighted the importance of trying to be as professional as possible, trying to earn my keep, and embrace the knowledge, the tactics, techniques, and procedures, the doctrine of military psychiatry, in order to prove him wrong. And so it was really that need to prove myself that I think transformed my identity from a psychiatrist in the Army to an Army psychiatrist. Then went on to Heidelberg, U.S. Army Medac, worked under Colonel Al Kopp, who's just passed recently. And there I met Doug Waldrop, who many who've been through Walter Reed know very well. After that assignment, went to Dwight D. Eisenhower Army Medical Center. And there was my first opportunity to work in an academic medical center, back when we had a psychiatry residency there. And really met the first of what I call the next generation. Chris and Jen Lang were two of my first residents that I trained. The next year, along came Scott Moran, and many others came through that program that I really hold dear to this day. After that, I went to Command and General Staff College at Fort Leavenworth. There again, became ensconced in military history and operations, and really then began to learn the importance of the doctrine and the lessons learned from all those who went before us. Learned about Colonel Salmon at that course. Also learned about early combat stress control doctrine through the ages, and as well as ancient military history when we started to learn about the psychological effects of combat. After Command and General Staff College, I went to Fort Meade Medac, where I was the Deputy Commander for Clinical Services, and served at Site R, the relocation site for the Pentagon during the 9/11 attack, and really saw firsthand how military operations are conducted and the importance that we as medics play for the combatants on the battlefield. After that came to Walter Reed, which really allowed me to plant my roots in academic psychiatry and begin to serve as a translator, perhaps, of operational into academic medicine for many of the trainees there, and began to grow the roots deeper in terms of really appreciating psychiatric doctrine and the academic history that really informs it. You know, of course, the colleagues at Walter Reed are still some of my dearest friends. Steve Koza, Hal Wayne, Ted Nam was there at the time, Greg Landy, and Brett Schneider, all very important to this day in our community. Out of Walter Reed, deployed to Operation Iraqi Freedom with George Brandt, who was at Walter Reed at the time, and then took command of the 528th. And we took Aaron McLaughlin, whom many of you may remember, with us on that deployment. And all of those experiences really enriched my sense of purpose, my identity as an Army psychiatrist, and I hope inform the legacy that I might leave one day through the trainees that I've worked with, such as yourself and all the current members of the society. I'd like to take a second and reflect on the importance of our society. SUSP really gives voice to operational medicine, to the needs of the warfighter in our APA. Um, our APA is working day in and day out to advocate for quality care for our patients, fair treatment of psychiatrists in terms of reimbursement, legislation around ensuring that people have access to the care that they need. And SUS plays an important role in that, both in the governance of the APA through the APA Assembly, as well as providing a community for people who travel around the world with their military careers and haven't yet set up roots with a localized district branch. So SUSP has been very important, for our profession, and really important for me personally. I've been a SUSP member my entire career, and I really want to thank the membership, the nominating committee, and everyone who's made this award granted to me, and really made me very so pleased and thankful to have such great community that I call home. So thank you very much, and have a great day.